Okay. Hi, this is Dina Schwarzkopf, and what we're doing for this portion of the video for health assessment is of 6511 Walden University is the musculoskeletal. And what I'm going to do is I'm going to start with the hands, and we're going to move to the elbows, shoulders, head, neck, and so forth. So what I'm going to do first is inspect the hands. Everything starts with inspection. I'm going to inspect the fingers and the wrist, and what we're going to do is I'm going to have you flex down and then bring your hands back and then spread your fingers out this way and then in this way, and we're just looking for rotation to make sure that you've got all the movement. Next I'm going to inspect the fingers, and for warmth, what I'm looking for is heat, redness, swollen joints, anything like a osteoarthritis or rheumatoid arthritis. And do you have any pain or anything like that in your fingers?
No.
They're nice and warm. Okay. The next thing we want to do, there's several tests that we can check, and the first one is called the snuff box test. And what we're checking for, I'm going to have you bring your thumb up, is a navicular problem, and I'm looking for the tendon here, and I'm going to push down on that, and if there's any pain in the thumb area, pain in this area, that can be a navicular fracture or navicular problem. The next thing what we're going to do is we're going to check for carpal tunnel. There's two big tests that we can do. Have you put your arms down? And what I'm going to do is I'm going to tap on the medium nerve. And do you have any kind of sharpshooting pains in the first three, the thumb and the first two digits? Just kind of relax your hand. No problem with that?
No.
Okay, the next one is the Phelan's test, which was like a reverse prayer test. And put your hands down and then push in for about 30 seconds. And what we're checking for is if there's any compression against the nerve. If there's compression against the nerve, Gary would feel numbness and tingling in his thumb, finger, and first finger and second finger. You can go ahead and release. Any numbness or tingling in this first three fingers? Okay. So that's negative. So he's probably okay as far as carpal tunnel problems. The next one would be the Finkelstein test. And what we're checking for on Finkelstein, I'll have you make a fist, tuck your thumbs in. And what I'm going to do is place my hand on your wrist and pull down. Pain in your right in here. Pull down. What we're checking for is tenosynovitis or de Quervain's. Tenosynovitis, which is very common with people who have to do repetitive movements with their wrists. And then the last test that I'm going to do on the hand would be the Allen's test. And what I'll do is I'll just have you squeeze your hand. And I'm going to compress both of the radial and the ulnar nerve. And I'm going to have you release the hand. And I'm going to release the ulnar nerve or artery. And see for blood, check for blood return back into the hand, and then we'll do the same again and open, and then I'll release the radial side and check for blood return, and that's telling me that there's good blood flow from both the ulnar and the radial. Go ahead and open. Okay. And squeeze, and go ahead and open, and good blood return on both sides. So that's telling me that there's good blood flow arterially, radially, and on the ulnar side. So next we're going to move to the elbow. There's basically three areas that we need to look at. It's the olecranon, the lateral and medial epicondyle, and I think we can see this here. What we're looking for is bursitis, and what we're feeling for is any kind of pain, discomfort in the elbow. The elbow doesn't have a whole lot that we have to deal with, but other than the bursitis, which is usually pretty easy to take care of. What I'm going to do is flexion. I just want you to go ahead and flex and then extend. And here's where we pronate and then supinate. Same with the other side. Flexion, extension, pronation, and then supination, which is great. So then next what we're going to do is we're going to move on to the shoulder area. So I'm going to have you go ahead and take your shirt off. And the shoulder is a little bit more complex. What we're looking for, we have to identify the landmarks. And what we're going to do is we're going to start with a sternal notch, both sides. We find the clavicle bone. We move out to the acromion. And what we're trying to do is identify where the scapula, clavicle, and the shoulder or the humerus comes into play, and this would be the acromioclavicular process. What we will do in this joint here determines movement or impingement, and there are several different ways that we can check for movement and impingement. One of them is just to have you go ahead and raise your arms up for flexion, and then the other one is to bring your arms back for extension as far as you can. There you go, which Gary has pretty good extension. What else we're going to do is we're going to have Gary bring his arms out for adduction, and then in and just cross test, yeah, and just keep your arms as straight as possible. And that tells me that you've got adduction and abduction. Adduction means towards and abduction means away. What we're going to do is do the Apley scratch test, which would be where I want you to bring your arm, yeah, and both of your arms here, bring them back, okay, and then up in reverse. And Gary has a little limited motion here. He can't quite make it up to the scapula, so he's got a little bit limited motion here, but he's middle-aged, and so that's more common for that. What we're also going to try is the Speeds test, which will check for biceps weakness, and I don't want to crowd the camera, but I'm going to have you hold your arms out like this, and I'm just going to push down, and don't let me push down. Okay, that was good. That was very good. He's got some good biceps movement there. What we're going to check next for is the Hawkins test, so I need you to kind of make a fist, kind of pronate it in, and I'm going to check your scapula. And what I'm going to do is I'm going to move it up. And what I'm checking for is popping or crepitus in the scapular area. Same with this one. Bring it up. And there's no pain, popping, or crepitus. Okay. Then the next one, the next test that we're going to check is what's called the, oh, I'm sorry, it was the Hawkins test is where you bring the shoulder in and you push down on the wrist and pop up on the shoulder. No pain?
No.
Okay. Same on this other side. Pop up. Okay. No problem. Okay. And then the last test will be the apprehension test, which is where you bring your arm out like a baseball, like you're going to throw a baseball. And what I'm going to do is I'm going to push into your scapular or shoulder area and bring your arm out. And any kind of pain, a baseball, and any kind of pain.
Nope.
Okay, a look of apprehension would tell me that you're concerned that there's some other area. Next, what we want to do is we want to inspect the neck and the jaw area for movement. And so what I'm going to do, I'm going to go ahead and inspect the TMJ. What I want you to do is clench your teeth and then open. Okay, close. And can you go sideways with your okay, very good. Okay, so there's no popping, crunching, or anything like that. Any pain?
No.
Okay. What we're going to do for the neck, look at the trachea, look for tracheal deviation, any extra swelling, pain, tenderness, anything like that?
No.
Okay, and then the next thing would be range of motion, which would be flexion, okay, and then extension, okay, and then cervical rotation to the side, left and right, and then lateral rotation, which would be the ear to the shoulder and the ear back. Okay, very good. No pain? Anything like that? Okay, so now what we're going to do is we're going to have you stand. Now I'll move the chair. What we're going to look at is the spine. Okay, so what we're looking for is any abnormal curvature of the spine, any pain or anything like that. There is a little bit of curvature in the upper spine, and there's a little curvature in the lower spine, which is normal. I'm going to have you put your arms to the side. Okay. And any pain when I palpate? Okay. What I am seeing here is a little bit of, seems to be a little bit of drop on the left side, which exposes the adipose tissue, pushes the adipose tissue a little bit more out to the left area, which kind of tells me that there might be a little bit of a differentiation in stance, but it could be just posture too. Okay, go ahead and twist and make sure that you can twist from side to side without any difficulty. And then I just need to do lateral movement and just have you drop your fingers down to your toes on each side. Okay, no problems there? So what we're looking for is we're looking for the same length in the leg, in the feet. And I'm not sure if I got that all on the camera, but the most important thing right now is to focus on the iliac crest, which they're both aligned pretty well. And then I'm going to find the greater trochanter. And what we're doing is we're looking for pain, bursitis, any kind of issues.
No problem.
Anything like that with the greater trochanter. The next thing what we're going to do is we're going to do movement. What I want to do is I want to check for to make sure that he's got a good enough extension. So what I'm going to do is I'm going to extend the leg back, which is pretty good. And I'm just going to check underneath to make sure that his spine flattens out as I bring the leg back. Okay?
No problem.
Okay. And then the same with the other side to bring the leg forward. And then just check with any pain or discomfort, which can signify any kind of a hip dysplasia or any kind of hip problems. No problems there?
No. Nope.
Okay. What I'm going to do next is, we already did the Thomas, that was called the Thomas test, I'm sorry. So now what I'm going to do is I'm going to do flexion. And no pain with that. Okay. Same. No pain with that.
Nope.
Okay. Very good. Okay. Now what we'll need to do is have you lift your leg up. Okay. See how high you can lift your leg. Okay. That's pretty good. Same with the other leg. Okay. And now what I'll need you to do is just roll over. And what we're going to do is what's called the extension. I'm going to place my hand on your back. Have you lay flat. And just have you extend. Okay. Which your extension's a little limited there. Do you have problems
Yes.
with stiffness in the morning and that kind of stuff?
Yes.
Okay. The next maneuver, what we would do is do the what I call the crossover test or the adduction. Sorry, as far as you can go. Okay. Same with the other leg, as far as you can go, which is pretty good. We want at least 25 degrees or more, and he's got that. So the next part, what we'll do is the internal rotation. And so what I'm going to do is I'm going to turn the knee out, hopefully about 90 degrees. Relax your leg.
Yeah.
And relax. Okay. Gary had a broken tibial plateau fracture a couple years ago, and they had to put plates and screws in. And I think you've got some limited movement here. Are you having some pain with that?
Yeah.
Can you bring that down? Okay. All right. So that's telling me that you've got some limited movement there. Can you relax this leg here and just kind of, there you go. Okay. And we got, very good. Okay. The left leg is great. The left leg has some very limited movement though, due to the
right leg.
yeah, the right leg has limited movement. The left leg is great. Okay, so what we're doing here is we're looking at Gary's knees, and what we're going to do is we're going to do the identify the landmarks, which is the femur, tibia, fibula, patella, and then the medial and the lateral condyle. The medial or the the meniscus basically sits in between here. So what we're looking for is any kind of pain on palpation. Do you have any kind of pain on palpation of any of your knees? Okay. And or swelling, redness, anything that signifies bursitis, cellulitis, or any kind of abnormality at this point. Move that back. I'm going to do what's called the ballottement test. And basically what I'm doing is I'm pushing down on the patella and I'm releasing and I'm looking for a fluid shift, which is what I'm not seeing. And then there's also the test which is called the balloon test, which is where you push down on the the femoral area and the anterior thigh, and you're looking for fluid accumulation in the knee area, and I am not seeing any of that. What we'll do next is what is called the drawer test. We're looking for a anterior cruciate ligament tear. And I don't know if we can get this on this test here. Bring this up here. Basically what I'm going to do is I'm going to bring the knee up about 90 degrees, stabilize it, and what I'm doing is I'm looking for subluxation. I'm going to put my fingers behind his popliteal area, my thumbs on the tibia, and I'm going to pull forward and up. And any subluxation or pain, no? And that is to go ahead and find the popliteal space with my fingers and my thumbs on the tibia and pull forward and up. And there's no shift. I can't feel any subluxation or relaxation of the leg. So that's telling me that everything is okay there. Okay, what I want to do is I want to check for a medial or a lateral tear. And in order to do that, I want to take my hand here, which I don't know if you can see very well, and my hand on the ankle, and I want to push in medially while I'm pulling out on the ankle. And is there pain medially?
No.
Okay. And then the same on the other leg, push in medially while I'm pulling out laterally on the ankle, looking for medial pain. And there's no pain there.
No.
Okay, and then the opposite for the lateral, I'm going to put my hand on the inside, push in on the ankle. No pain?
Nope.
Lateral side. And push in, and there's no. Okay. The other test that I want to do, and I want to make sure I can get this on here, is to bring the knee up, twist out. Is there any pain?
No.
Okay, and while I'm twisting out, I'm going to straighten the leg and pull. And if there's any pain in the knee, that will let me know that there's an AC or a MCL or a cruciate ligament tear or dislocation or disruption. Bring it out, twist, and straighten. And what we're looking is for discomfort or any kind of disruption of the articular surfaces. His ankles are nice and thin. There's no swelling. What I'm looking for is identifying the interior or the medial and lateral malleolus on both sides. And I'm looking for any kind of swelling or any edema. The other part would be the Achilles tendon on the back and the olecranon area of the heel, and then the plantar area of the foot, olecranon, Achilles, and then the plantar area. Gary has really nice high arches. He's not flat-footed by any means. What we'll also be inspecting is the tarsals, or the metatarsals, and the toes. What we're going to do is we're going to do what's called eversion. And I don't know if you can see this very well in this video or not. I want to move your leg in, or your ankle in, and then out, Okay? Same with in and out. Okay? And then dorsiflex towards you. Okay? And then push out.